Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, sitting here today in the 465 North Roxbury office with my associate and co-host, Dr. Millicent Rovelo.
Good evening.
How are you doing?
I'm doing great. How are you?
I am doing very well. I had a nice day of surgery, a little facelift, a little rhinoplasty, like all that good stuff, and some patience. And now we get to talk about breast revisions.
All in all, a good day for you.
How are you?
I had patients all day. I saw some patients, saw some consults. Now I'm here with you. And excited to talk about revision breast surgery.
So we're going to talk in this one, I think, this episode, we should really just focus on removal and replacement of breast implants after some amount of time. And we can talk about what that amount of time is. There are just so many different rules that people invoke when it comes to revision of breast implants.
Yeah, there's a lot. It's a big topic. There's a lot of subtopics to it, and you can sort of go off in many different directions. But I think I agree. Talking about removal and replacement as one single entity is a good idea because the whole separate entity is removal without replacement and how you have to literally reconstruct a breast after removing an implant if you don't plan to replace it. And that's a whole nother topic.
Yeah, that happens a lot.
Yeah, a lot.
People sort of get like, I'm done with these and
right.
Time to move on. But we're going to talk about today removing and replacing breast implants and how you handle that and when it's done.
Yes.
So let's get right into it. I mean, most of the recommendations by the breast implant manufacturers is 10 years after placement to swap them out.
Right. And I get that question all the time. Like, I'm coming up on 10 years or in 10 years, do I have to have these replaced? And it was never a hard and fast rule that at 10 years, you have to get your implants replaced. Where that started, though, is that years ago for older implants, 10 years was sort of their shelf life. After about 10 years, they were more prone to rupture. And so that's why the recommendations were 10 years, consider having your implants swapped out because they're probably going to rupture. And obviously, if they rupture, it's a much bigger deal and it's a bigger surgery. So let's exchange them before they rupture. Now, it's not that big a deal because, I tell my patients, I think almost all of the implant manufacturers these days have 20-year warranties against rupture. They believe that their implants
Right.
are going to last